Hi, I'm Roche. I work for Fairview Recovery Services at Voices Recovery Center. I'm a long-term man in recovery, and I'm passionate about this message that's been given to me. And that's why I do what I do every day. People say, why do you do it? I said, because someone did it for me. So this is a life-saving training that we're offering here, and I'd really like to be a part of the community recovery.
And my name is Kelly Sullivan. I also work for Fairview Recovery Services at Voices Recovery. And I'm a certified recovery peer advocate. And the reason I'm doing this is because Narcan saves lives. I have people in my life personally who are alive and well today, productive members of society because someone carried Narcan. Essentially, opiates fill the receptors in your brain that control your breathing. The receptors are essentially like a tunnel, and when they get overloaded with opiates, that's what causes an overdose. So when you administer Naloxone or Narcan, what it does is blows those opiates off the receptors, allowing the person to be able to breathe again.
There's a multitude of drugs that you can overdose on. It's not just heroin. There's any opioid prescription. There's fentanyl. There's a lot of drugs that are laced with fentanyl, methamphetamine, cocaine, things like that, that has really become common. A lot of they're just using that to expand the product, so it's in everything. And there's also test kits available to test your drugs to see if they're fentanyl laced and like that. But it's everywhere, and we never know when it's going to happen. And it has no prejudice. There's no place that overdose does not happen. We need to be aware of the symptoms.
And I think it's important to remember that it's not just addicts who can overdose. It could be your mom who's prescribed a medication for pain, who has a glass of wine, or gets another medication prescribed and it interacts with that medication. So it's always safer to have Narcan than to not. So when coming across someone who seems unresponsive, or you suspect it could be an overdose, or you don't know what's happening, it's always better to attempt to administer the Narcan than to try to figure out what else it could be. When you come across someone who you suspect might be overdosing, you want to check to see if they're responsive. You can shake them, say their name, ask if they can hear you, and perform a sternum rub. It's important to call 911 when you suspect an overdose. When you call 911, all that you want to say is, I have a person who's unresponsive. A lot of people avoid calling 911 who are using with the person, fearing that they might be arrested. There is a law that protects you from a lot of charges that could happen, so we always encourage people to don't be afraid to call 911. There is a law that protects you if you happen to be using with that person.
Good Samaritan law. You hate to put it in a group because we're trying to stay away from the stigma, but a lot of people that are involved in that activity are fearful of being arrested and just being in that situation. So we have to know that the person's life comes first.
And there will be an insert in your kit that explains the Good Samaritan law further, so you can read more details about it. So it's important to administer Narcan, as the brain can begin to die after 4 minutes without oxygen. It takes much less time than that to administer Narcan and attempt rescue breathing, which we'll talk about a little bit later.
The whole 4-minute thing, you got to remember that this is happening in a minute. I mean, you have to react immediately and start in this whole process, and 4 minutes is a lifetime.
If you have Narcan on hand, it is always better to just try and then go from there if it's not having any effect. Try the Narcan, call 911, and then reevaluate. So once you've administered Narcan, you're to wait 2 minutes in between doses, which can seem like an eternity when you have someone who's not breathing. That's why it's important to do rescue breathing in between. That's how you're gonna get the oxygen to their brain, so they aren't losing that oxygen for those 4 minutes, even if the Narcan doesn't work. Narcan will wear off 60 to 90 minutes after being administered. So even if the person is conscious and seems to be better, the opiates will reabsorb into their brain and they can re-overdose after that.
Right, there's a lot of times when people come out, when they come to from the Narcan administration, they become angry, disoriented, they don't know where they are, they don't know who you are. Just make sure you stay with them, stay supportive, stay calm, and let them know help is on the way.
And again, that's important when you consider the person in your home who is prescribed an opiate, who you would never consider to be an addict. They are still dependent on that opiate medication that has been in their system, so they also will be in precipitated withdrawal. So it may be your mother who has never used an illicit substance in her life, who is dependent on Vicodin for pain, and when the Narcan is administered, that will blow that entirely off their receptors and create withdrawal, which is physically painful.
So is there more than one kind of Narcan?
So Naloxone is actually the life-saving medication. That is what the medication is called, and Narcan is the name brand. It comes in a nasal spray that looks like this, that you would just insert into the person's nose and squeeze. So Narcan historically has come in either injection or nasal spray. They are now moving to solely nasal spray. You do not want to do a test spray when you open it. Don't test it to see if it works. The entire dose is what's in there, and you want that to get entirely into the person's nose when you administer the Narcan. When you come across someone who you suspect might be overdosing, you want to check to see if they're responsive. First thing you want to do is get the person to the ground, flat on their back with their legs straight. Remove the Narcan from the plastic packaging and make sure the person's head is tilted backwards. Place your thumb on the nozzle and your index and middle finger on either side of the plunger and gently insert the Narcan into their nostril. Press the plunger all the way in to administer a full dose and call 911. If the person is not breathing, perform rescue breaths, using their chin to tilt their head backwards, plug their nose, and do 2 quick breaths. After that, rescue breathing will be 1 breath every 5 seconds. While you're performing the rescue breaths, look out of the corner of your eye to see if you can see the person's chest rising while you're breathing. If you do not see their chest rising, the oxygen is not getting to their lungs or their brain. Tilt their head back a little further and make sure their nose is plugged before continuing rescue breaths. If the person is breathing, you want to roll the person onto their left side and put them into the recovery position. So because they can re-overdose 30 to 90 minutes after the naloxone, it's important to call the ambulance, wait till they show up, and put them on their left side with their knees bent in case they do begin to vomit. Their knees bent will keep them from rolling back over and will keep them in position so if they do begin to vomit, it is not choking them.
People are afraid to administer Narcan, not knowing if the person overdosed or not, and it will not cause any harm to any other medical condition.
If a person's having a heart attack, a stroke, or a reaction from another medication, administering Narcan will never do any harm. So it's always better to administer than to not. The reason to carry Narcan is to give someone a chance to live. Again, this is not just limited to addicts. It could be your own mother, your sister, your cousin, your father, your brother in your home who overdoses on a prescription medication. We're giving people the chance to live. And even if it is someone who struggles with substances, they still deserve a chance to live long enough to get better.
It's a life-saving lesson that we all need to learn. Narcan is available for everyone, and we need it accessible to all because you never know when, who, where, or why this may happen, and we need to be on top of that.